Good morning, this is Dr. Deepa from SRM Dental College, Ramapuram, Department of General Pathology. Today's topic of discussion is edema. As you can see in the picture, there is swelling in the feet. So this swelling is nothing but edema, which is caused due to excess fluid trapped in the body tissue. So body tissue which is nothing but the interstitial tissue space as well as the serous cavities. So any excess accumulation of fluid in these spaces can lead to swelling, which is nothing but edema. Coming to the types of edema, we have pitting and non-pitting edema. As we can see in the picture, there's a indentation or depression that is formed in pitting edema. So, pitting edema displaces the fluid. Upon applying pressure, fluid is displaced, causing indentation. Whereas in non-pitting edema, there is no such indentation formed. So, chronic pitting edema is often a sign of liver, heart or kidney problem. On the other hand, non-pitting edema is generally seen in condition that affects the thyroid or lymphatic system. Depending upon the body cavities, edema is further classified as ascites. So ascites, which is nothing but buildup of fluid in abdomen. That is, there is excessive buildup of fluid in abdomen, which can be caused as a result of cirrhosis, which is nothing but a liver disease. So here what happens is there is fluid gets collected in spaces within the abdomen, and this fluid collects in abdomen can affect lungs, kidney and other organs also. On the other hand, the collection of fluid in pleural cavity is called as pleural effusion. So when a person has pleural effusion, it means that the fluid has collected in the space between the lungs and the chest cavity, or which is otherwise called as a pleural cavity. Next in list is the pericardial effusion. Pericardial effusion is nothing but the buildup of too much fluid in the double layered sac-like structure around the heart, which is the pericardium. So this space between these layers generally contains some amount of fluid, or there may be a thin layer of fluid present normally, but when this fluid increases due to certain conditions such as maybe due to inflammation, there will be excess collection of fluid. Apart from inflammation, there may be excess collection of fluid which can be because of bleeding or related to cancer or any other chest trauma. Depending upon the fluid composition, edema is further classified as transudate and exudate. So transudate is fluid accumulation that is induced by systemic disease that will change the pressure of the blood. So whenever there is change in blood vessel pressure, there will be forcing of the fluid outside the vascular system and hence collection of fluid in the interstitial space. Whereas exudate is fluid that accumulates from tissue leakage caused by inflammation or local cellular injury. So the difference here is the pressure of blood vessels. So when there is increase in blood vessels and there is exit of fluid outside the blood vessels, it is because of transudate, or the condition is called as transudate. Whereas there is movement of fluid out of the blood vessels due to inflammation or injury to the endothelial cell layer, then it is called as exudate. Edema can affect any part of our body. So we may notice it more in the hands, arms, feet, ankles and legs. Apart from this, other organs can also be affected because of edema. Causes for edema. Many things can cause edema, some more serious than the others, but sometimes there is no clear cause. This is known as the idiopathic edema, when we really don't know the cause of edema or collection of fluid. In general, some causes of edema are related to our lifestyle, while others are related to the underlying medical conditions. Some of the most common cause of edema are linked to daily habits and lifestyles. So among them, the first one is staying in same position for too long. This includes lying in the bed for long period of time, traveling, or generally sitting or standing for long period of time. Then next is eating too much of salty food. So in the diet, if the salt content is more, then it can lead to edema. Then coming to the overweight, when the person's weight is more than the actual, then it can lead to accumulation of fluid. So the medical conditions that can cause edema are many. So among them, few are listed out here. So the normal body changes that can cause edema is during pregnancy. A pregnant woman is more likely to get an increase in accumulation of fluid, which is physiological. Or during menstrual cycle, also there is collection of fluid. The other medical conditions which are listed here are the insect bite. Whenever an insect bites or stings, there is accumulation of fluid because of inflammation. Then we have physical damage. Any physical damage can lead to accumulation of fluid. Then the others are the drugs. So certain drugs like those used for blood pressure and those used for depression, that is antidepressants and contraceptive pills, all these can lead to increased accumulation of fluid. Then the heart failure, liver diseases, kidney diseases, chronic venous disease, when the valves that help blood flow through the veins are damaged, then there may be increase in accumulation of fluid. Then angioedema, this which is nothing but type of allergic reactions. All these conditions lead to abnormal accumulation of fluid. Symptoms of edema. So the main symptom of edema is swelling of the affected part of the body. In some cases, this may look like obvious swelling or puffiness, but at other times, it may just look like shiny, stretched skin, which may also be red. This swelling often happens gradually, but in some cases, it can appear suddenly or all of a sudden. You may also have other symptoms depending upon the cause of edema and the area of the body affected. These symptoms may include puffy eyes, especially on waking up in the morning. Your skin or body feeling tight or full. Pain in the swollen body part. A swollen tummy if you have edema in the tummy. Shortness of breath or trouble breathing as normal if you have edema in your lungs. Then there may be even headache, heavy and achy arms, legs, trouble moving around, or there can be a clear fluid that leaks from the skin. If there is buildup of lymph nodes, then this can happen. Then a really bad headache if you have buildup of fluid around the brain. Coming to diagnosis. To understand what might be causing edema, the doctor will first perform a physical exam and ask questions about medical history. This information is often enough to determine the underlying cause of edema. In some cases, X-rays, ultrasound exams, magnetic resonance imaging, that is MRI, then blood test or urine analysis may also be necessary. Moving to treatment, it requires the identification or diagnosis of underlying disease, that is the cause of the edema, and treating it, and then moving to removing of the fluid, that is taking medication to remove the excess fluid and then to reduce the amount of salt, because the more the amount of salt, the more water is retained in the body. So this is the mode of treatment.